Do you know what competencies you need for your next job in medicine? Do you even know what a competency is? Well, find out in this video. Today we're talking about competencies. Why? Well, I've been recently coaching a group of doctors who are applying for selection into training into both the College of Surgery as well as the College of Ophthalmology. And the interesting thing is that often my conversation turns to the fact that there are various competencies or competency frameworks that these colleges, in fact every college in Australia and New Zealand, uses to determine how they select their trainees into training, as well as how they develop their trainees and even how they regard their fellows once they're through the program. So one of the things I try to point out in my coaching programs is the importance of understanding the key competencies and the relevance of them to selection. So what's a competency? Well, competencies are generally a set of skills, behaviours, attitudes, capabilities. They are generally at a fairly high level because, for example, one key competency that often pops up is communicator. So a set of skills and behaviours and competencies around being an effective communicator. And these are used to set standards for how we might select people into roles. They're not just used by colleges, they're actually used by a lot of organisations, including public health organisations. So, for example, most health services in Australia also have a competency or sometimes called a capability framework. So understanding these competencies can give you a really powerful insight into how the panel is looking at you in a selection and interview process and what they're actually looking for. It can give you a serious advantage over people who are unaware of these competencies. Let's have a look at a few examples. Okay, here's the booklet that the Royal Australasian College of Surgeons provides to prospective trainees as a guide to surgical education and training. And if we skip down to page 3 of this book, we see the competencies and training standards that the College of Surgeons applies to surgical trainees, not just for when they're training, but how they're selected into training. So you can see that there are 9 competencies and training standards, starting with collaboration and teamwork, communication, health advocacy, judgment, clinical decision making, management and leadership, medical expertise, over the page, professionalism and ethics, scholarship and teacher, and then technical expertise. Look familiar? Well, the reason it looks familiar is it's derived from the Royal College of Physicians and Surgeons of Canada's CanMEDS framework, which is now in its 2015 version. This is the mother of capability frameworks or competency frameworks for medicine, and pretty much every capability or competency framework in medicine and now in other fields is derived from this framework. In fact, there's quite a good relationship between the college in Canada and all the colleges in Australia and New Zealand. They got on very well, and they've helped each other. In fact, the Royal College of Canada has really been involved in developing frameworks for a number of our colleges here. So you can see there's 7 domains in this one, with a medical expert in the middle, professional communicator, collaborator, scholar, health advocate, and leader. Let's look at another one. The College of Physicians training curriculum. Again, for both adult physician and paediatric trainees. We come to the curriculum domains, themes, and learning objectives. And you can see there's a number of domains that are important to the college physicians in terms of how trainees are both selected and how they're trained. Again, communication, quality and safety, probably a bit of a derivative of advocacy there. We've got a scholar domain, teaching and learning, cultural competencies. Credit to the College of Physicians for adding that one in. I think that's very important to have cultural competencies standing at a very high level. Ethics, clinical decision making, leadership and management again, health advocacy, and again, a new one, the broader context of health, which might be partly a derivative, I think, of scholarship, but also, again, health advocacy. Looking at my own college, the College of Psychiatrists, they've just basically adopted the framework, and I think that's a good approach. Medical expert, communicator, collaborator, manager, health advocate, scholar, and professional. And then if we go to the College of Ophthalmologists, they've implemented a new process for selection and training this year, and again, they've adopted the CanMEDS model, and you can see how they weight for selection. They review your curriculum via T, and they give you 5% for your scholar. And then when they look at your references, there's a weighting for how much of a medical expert you are. Again, a small weighting for being a scholar, and then professional attributes, which include the key CanMED roles of communicator, collaborator, manager, health advocate, and professional. And again, these are assessed in the situational judgment test and also at the multiple mini interview. So you can see If you didn't know this, if you weren't aware of these competencies, you would be at a serious disadvantage when applying for selection and training to any of these particular colleges. So you can see from a college perspective that competencies are basically the underlying framework by which you are selected into training, you're trained through the college, and ultimately regarded as a fellow of the college when you're maintaining your professional development. Which brings me to an important point. See, it's not just the colleges that use competency frameworks. In fact, you often see these frameworks popping up in employer jobs for both trainee doctor jobs as well as for senior doctor jobs. And that's because the original framework, the CanMEDS framework, is actually a very useful framework, and it's actually useful to employers as well when they're trying to work out which doctor they want to select into a role. Measuring people by the ability to communicate, show medical expertise, being a professional, is a pretty good idea really when you think about it when we're interviewing and selecting people into doctor roles. So some key points here. Firstly, you need to know what your relevant competencies are. You need to be able to know them off by heart. I'd recommend printing them off as part of your preparation process, sticking them to your office wall or your bedroom wall, wherever you're going to look at them regularly, and read them regularly and use them and incorporate them into your practice. That leads me to a second point. You need to then have some examples that demonstrate that you are a quality achiever against these competencies. These examples will be vital and useful when you come to the interview process, but they should also go into your CV or resume. And thirdly, also practice interview questions of the hypothetical nature using the competency framework. The competency framework will assist you to give a more rounded answer because it will highlight areas that you might not have necessarily thought about that could be relevant to that particular hypothetical question. When I train my coaching trainees for interview practice, we do this sort of work. You don't necessarily have to hit every competency per hypothetical question, but you usually find that by using the competency framework, you think about another area that you wouldn't necessarily have thought about in your answer. Now, if you would like to know more about the job selection and interview process or need some additional help, I recommend picking up a copy of Interview Success, Mastering the Medical Job Interview. That's available from my website. You might also want to think about attending our workshop on the 29th of June if you are in Sydney or around Sydney on that date, where we go through comprehensively the whole trainee selection process. And finally, you might want to consider some of the coaching options that I have available. As is always, please leave a comment or a like below if you like this video or want to ask a question. Give me some feedback on the types of new videos that you'd like me to make around the medical career process. Always open to feedback. Turn on notifications and subscribe, and I will see you in the next video.